The way of learning. Today's topic is red blood cells exhibited for staff nurse interns. First one is lifespan of fetal RBC. Option A 80 days. Option B 5 to 7 days. Option C 120 days. Option D 100 days. Correct answer is option A 80 days. Next one is lifespan of RBC is option A 100 days, option B 120 days, option C 140 days, option D 80 days. Correct answer is option D 120 days. Next one is the average HB content of human blood is option A 18 to 23 gm per dl, option B 14 to 16 gm per dl, option C 8 to 10 gm per dl, option D 16 to 20 gm per dl. Correct answer is option B 16 to 20 gm per dl. Next one is normal adult hemoglobin contains option A 1 alpha chain and 1 beta chain, option B 1 alpha chain and 2 beta chains, option C 1 beta chain and 2 alpha chains, option D 2 alpha chains and 2 beta chains. Correct answer is option D 2 alpha chains and 2 beta chains. Next one is which of the following is correct concerning fetal hemoglobin? Option A hemoglobin is present only in fetal life. Option B hemoglobin is composed of 2 alpha and 2 gamma subunits. Option C hemoglobin has decreased oxygen carrying capacity. Option D hemoglobin is composed of 2 alpha and 2 beta subunits. Correct answer is option B hemoglobin is composed of 2 alpha and 2 gamma subunits. Next one is hemoglobin is a type of option A carbohydrate, option B respiratory pigment, option C skin pigment, option D vitamins. Correct answer is option B respiratory pigment. Next one is RBC are formed in or hematopoiesis occurs in option A liver, option B small intestine, option C kidneys, option D bone marrow. Correct answer is option D bone marrow. Next one is the term used for process of RBC formation is option A apoptosis, option B hemodialysis, option C erythropoiesis, option D hematopoiesis. Correct answer is option C erythropoiesis. Next one is what is the process by which blood cells are formed is called option A hemostasis, option B hemoglobin synthesis, option C hematopoiesis, option D hemodialysis. Correct answer is option C hematopoiesis. Next one is red blood cells are synthesized in the embryonic life in the option A yellow bone marrow, option B yolk sac, option C red bone marrow, option D kidneys. Correct answer is option B yellow sac. Next one is which organ is primary site of hematopoiesis in the fetus before mid pregnancy? Option A lung, option B liver, option C bone, option D spleen. Correct answer is option B liver. Next one is in which stage of erythropoiesis does the cytoplasm become polychromatic? Option A reticulocyte stage, option B intermediate normoblast stage, option C early normoblast stage, option D pro-normoblast stage. Correct answer is option B intermediate normoblast stage. Next one is hemoglobin appears in which stage of erythropoiesis? Option A intermediate normoblast stage. Option B, early normoblast stage. Option C, late normoblast stage. Option D, reticulocyte stage. Correct answer is option A, intermediate normoblast stage. Next one is, which of the following is most mature normoblast? Option A, orthochromatic normoblast. Option B, basophilic normoblast. Option C, pro-normoblast. Option D, polychromatic normoblast. Correct answer is option A, orthochromatic normoblast. Next question is, normal reticulocyte count of blood is option A 1 to 2%, option B 5%, option C 10%, option D 25%. Correct answer is option A 1 to 2%. Next one is, which of the following statements about red blood cells is true? Option A, they have a nucleus. Option B, they are produced in the liver. Option C, they contain hemoglobin for oxygen transport. Option D, they have a lifespan of several years. Correct answer is option C, they contain hemoglobin for oxygen transport. Next one is, the normal diameter of RBC is option A 7 to 8 um, option B 6 to 7 option C 8 to 9 option D 9 to 10 Correct answer is option A 7 to 8 Next one is, most important function of red blood cell is option A to provide first line of defense, option B to transport oxygen from lungs to the tissues, option C to prevent bleeding by hemostasis, option D to act as anti-parasite and anti-allergen. Correct answer is option B to transport oxygen from lungs to the tissues. Next one is, which single feature of normal RBC is most responsible for limiting their lifespan? Option A, loss of mitochondria. Option B, increased flexibility of cell membrane. Option C, reduction of Hb iron. Option D, lack of nucleus. Correct answer is option D, lack of nucleus. Next one is, nursing care for patient with polycythemia vera would focus on preventing option A, dysthymia, option B, hypotension, option C, diabetes ulcers, option D, thrombosis. Correct answer is option D, thrombosis. Next one is, total RBC count for women is option A 4.4 to 6, option B 3.9 to 5.4, option C 4.2 to 5, option D 4.2 to 5.6. Correct answer is option C 4.2 to 5. Next one is, which of the following is the most abundant type of blood cells? Option A thrombocyte, option B erythrocyte, option C lymphocyte, option D monocyte. Correct answer is option B erythrocyte. Next one is, ESR means option A electrolyte sedimentation rate, option B enzyme synthesis rate, option C erythrocyte sedimentation rate, option D erythrocyte synthesis rate. Correct answer is option C erythrocyte sedimentation rate. Next one is, the best test to assess the prognosis of the patient is option A osmotic fragility, option B hemoglobin level, option C packed cell volume, option D ESR. Correct answer is option D ESR. Next one is, hematocrit means option A expected to decrease in polycythemia, option B expected to increase due to hemolytic anemia, option C is typically between 28% and 48% in normal adult males. Option D, increase due to an increase in EPO released by the kidney. Correct answer is option D, increase due to an increase in EPO released by the kidney. Next one is, what is the approximate normal level of hematocrit or paired cell volume in men? Option A, 5% to 15%. Option B, 20% to 35%. Option C, 60% to 70%. Option D, 40% to 50%. Correct answer is option D, 40% to 50%. Thanks for watching. Like, comment and subscribe the channel.